We are looking here at a pig fetus. Some of the main things you're going to want to note at first is the head, which sports a pair of eyes and a pair of nares, as well as a mouth and a tongue. Moving down here to the trunk, or its main body, you'll notice attached to the trunk are 4 appendages, where if you look closely you can see are hooved. And then you have the tail end here, which also contains its anus, which if we look at the tail here, we can see that there is just the hole for the anus and no vaginal opening, and a sac where the testes would go. So it having a scrotum means that this fetus is male. We can also look up here to the trunk again. On the ventral side, if I turn it on its dorsal, onto its back, we can see here that we have the umbilical cord, which has its red umbilical artery. These were used to transport nutrients and waste out and nutrients in during the fetus's time in the mother's womb. Also, some more things to note here. If we look at the ventral side, you can hardly tell probably in the video, but there are sometimes up to 8 pairs of nipples here, and there are nipples right here. Also, something I forgot to mention earlier is the set of ears that are on top of the head up here. And that's about everything you're going to notice after inspecting just the outside of it. So what I'm doing now is I'm going to be opening up the buccal cavity so that we can look at the pig's papillae, tongue, palate, hard and soft, the epiglottis, and the glottis. So I'm cutting along the inside of the cheek so I can get a better look inside here. Sorry, take a second to get that done. Now that I've done that, I can open up its mouth. It's a little tough. Sorry, a little more cutting happening here. There we go. So now that I've successfully opened up the buccal cavity here, point out the tongue and little baby teeth forming up in here in the top. Soft palate and hard palate are within here as well. If we look back into its throat, you can see its epiglottis. Hopefully it's all the way back in there. And that's really about all you're gonna see looking through here in the pig's mouth. Welcome back. Now I'll begin cutting the pig open so we can check out what's inside this bad boy. So my first incision I'm going to be making is here, right above the umbilical cord. I'll be cutting all the way up to the bottom, basically kind of the top of the neck, and then I'll be making 2 incisions out to the left and to the right. Then I'll be moving down here, making incisions just right where the hind legs seem to meet, inside a little bit, and then cutting up and around the umbilical cord area here and pulling back these flaps of skin, as well as cutting where the top cavity, what's it called? Basically where the diaphragm separates these 2 cavities. I'll have some more technical terms when I go into detail once I've got this bad boy opened up. All right, now that I've got this bad boy opened up, now we can take a little bit of a look inside here. As you can see, I did all those incisions I said right before. A couple things to point out here is we have our thoracic and our abdominal cavities, and they are separated by the diaphragm, which is a thin layer of muscle that helps, the lungs and all that other jazz that we love to do and love to look at. We love to see it. But basically, I've already kind of cut through it, so you can see is right here, separates these 2. Another thing to point out here is we still have our umbilical cord, and then the umbilical vein, which is actually attached to the liver, is right here and intact. Take a look at it right there. And then we have all these flaps here, which I can pin down, but I can't really do it at this lab kit. It just doesn't stay very well. Normally you would though. So yeah, that's about everything for part 1 here. Part 2, I'll see you guys then when I'll be kind of taking a look at some more of these organs.